Hello and welcome to Island Health's instructional video on how to perform a pre-standing safety check. This quick screening tool helps ensure the safety of both the person standing and the caregiver. Let's get started. Always complete a point-of-care risk assessment prior to any patient handling care. This assessment may be displayed like this on any paperwork or care plan. The pre-standing safety check is a tool for caregivers that should be used each time a person is assisted to stand, because a person's status can change. Portions of the tool may be incorporated into one's regular work routine, and the steps need not be completed sequentially. Ensure the person is ready, willing, and able to accept assistance. Ask them if they feel comfortable and if they have any pain or discomfort. Next, consider any behavioral factors. Look for signs of fear, anxiety, or unpredictable responses. These can affect the person's ability to stand safely. Now, perform a physical assessment. Core and hamstring strength. In bed with their knees bent, have the person bridge by lifting their hips off the bed. If a person lacks core strength or hamstring strength, they are at risk of falling when standing or ambulating. Balance. Check if the person can sit unsupported. If they can't sit unsupported, they are at risk of falling when standing or ambulating. Leg strength. In sitting, have the person extend at the knee and hold straight and unsupported. Strength on one side is sufficient if the person has unilateral weakness or joint limitations and will be standing primarily on one leg. Low back strength. In sitting, have the person lean forward and then straighten up by cueing the person to look at their toes and then right themselves. Ability to follow direction. By now, you will know if they are able to understand and follow your directions cooperatively. For some populations, like those with dementia or cognitive impairment, comprehension may be compromised. This poses a risk to the caregiver who assists the person to stand, regardless of the person's physical ability. If a person with dementia requires assistance to stand, make every effort to follow tests 1 to 4. If their comprehension is judged to be consistent as per normal, proceed with caution and be prepared for a docile or uncooperative response. If the person fails any of the tests, you have two options: wait and repeat the tests, or resort to the safest method and use a mechanical lift if available. Ensure that you are reporting any change of status to the interdisciplinary team and request a reassessment by the physiotherapist or mobility expert. Thank you for watching. For more videos like this, check out our OC Health YouTube channel.